Every hour of the program, Monday to Friday, is open lines 800-259-5791. And you can call in. It has to be appropriately to the specific topic we're talking about. Now we're on Nutrimeds, and Ryan will be connected with him in just a moment. We want you to understand that when we put the Nutrimeds together and we are designing them or private labeling, I assembled the very most powerful Nutrimeds on the planet. You don't need to go elsewhere. I know there's commercials that are on this show or on this network, and there are all kinds of alternative people that think that they have the knowledge to know what to do. And I've actually had, recently I had someone say, Dr. Deagle, you shouldn't say that you know all these things. You should pretend that you're just nice. No, I'm not nice, okay? When I've been at this 40 years, and I've started off doing both environmental medicine, environmental research, and then medicine over 40 years ago, these other people are not competitors. They aren't even in the field. You have to understand we're going to provide you with the very best nutraceuticals, which are like pharmaceutical-grade Nutrimeds. We're going to give you the diagnostic technologies as to how to identify if they're on the right track for their specific health problem. We're going to refer you when it's appropriate for surgery or medical care, and the 20% of the time when even a drug is appropriate. No one else is going to do that for you. We're also going to give you recommendations on how to actually fix the problems, preventing cancer, reversing heart disease, reversing hormonal problems, reversing many illnesses, including metabolic disorders for yourself and your family that are present based on genetics. So when we look at our Nutrimeds, please do not waste your time or my time thinking you can second guess what we're providing. You can't. Don't even try. It's a waste of your time, and don't think, I'm not being arrogant over this. There's a difference between competency and arrogance. I'm here because I want you to get the very best and not waste your money on things that are not going to work. For example, if you look at we have Ryan now. Ryan, welcome back to the program.
Dr. Bill.
Hey, I was talking about telling people the importance that we're not, quote, talking to, quote, sell nutraceuticals or vitamins. We're selling Nutrimeds, which are basically a pharmaceutical grade of a nutritional molecule in a special delivery system, powerful enough in its special bioconverted or stabilized form that it'll change your biochemistry, change your pathology before you even get its symptoms or signs, or before you have a disease state present. And if you do have a disease state, we're going to reverse the underlying problem rather than covering it up with a drug that blocks the receptor or does something else. There's a lot of pretenders to the throne that think somehow they can flog a nutraceutical on either my show and commercials or other people on this network that think that they have comparable levels of knowledge or experience to me. And it's just, I think it's an obscenity. It drives me nuts to see people that think they know. And I consult with doctors and patients all over the world.
I think that it's whether that's an advertisement on your show or whether it's every store they walk into, somebody saying that they've got something, that's the best out there, but they don't really have any clue as to really the application, and it's buyer beware. So, people love the latest and greatest advertising, just like a fish likes a shiny lure, but, you got to know your science. You got to know what's going on with bioavailability, and that's where the Nutrimed proves itself into be a different type of, product that can deliver a different type of result.
One of the things I was doing earlier is I was going over different wellness conditions and I find that very helpful. Recently just talking about prostatism, and I want to kind of go over that again because I think it's important that people understand this is a good example of a lot of what we call informational flogging for people who don't understand. And I'm going to give some teaching now there for if you're a physician or naturopath or chiropractor, if you're a man that wants to know the biology. The German term for the tissue in the fetus in the developmental phase before the 6th week, and the German term is called Ergenlagen. The Ergenlagen is a tissue that in females will turn into the uterus and males turn into the prostate. And the Ergenlagen has receptors for estrogen. So if you have xenoestrogen molecules, biotoxins are primarily halides, they're going to make the Ergenlagen grow, and it'll actually obstruct your prostate and cause prostatism. And if your prostate's inflamed, you can forget about having sex because your prostate's screwed up. You can't have contractile activity of your vas deferens, seminal vesicles of your prostate during your orgasm. Orgasm ain't happening. How's that? So if you want to protect your prostate, you don't want to try second hand, second best. You want to fix the problem, and you don't want to let some stupid surgeon do a non-vascular sparing surgery or radiation treatment or gold seed therapy or point-by-numbers chemo without specifically testing the specific gene abnormalities present in your cancer. So for prostate problems, I start off with prostate flow, I usually recommend, if you already have a problem, 2 soft gels twice a day, hormone synergy, 2 capsules in the morning to prevent your male hormone from being converted by your adipose or fat tissue into female hormone. That's a bad thing because it makes the ergon login grow. Men's Max, it releases your male hormone from your binding globulin protein. Vision Max to heal and protect your prostate from prostate cancer, along with Nutridefense, the most powerful antioxidant, which in the studies done in Japan, the anhydrous catechin, not one man in 20 years out of thousands got prostate cancer, not one. Swedish flower pollen, we use a capsule, 1 tablet to 2 tablets 4 times a day for the alpha-1 blocker, natural, and bladder up. And, of course, full vitamin K2, extremely important to decalcify the prostate gland and to protect the DNA, ellagic acid, and malignoblock. So that gives you the complete, but let's have a look at it. Prostate Flow, Hormone Synergy, Men's Max, and Vision Max to start with. Prostatism is not a minor problem. If you look at males over age 30, not even 40 anymore, it's rampant. Men having early subtle symptoms, running to the bathroom, pressure, inability to properly have ejaculation during sexual activity, chronic low-grade pressure symptoms, especially if they're sitting on, say, a tractor vibrating or excavating all day long, or driving if they're a driver like a truck driver. Chronic prostatism is incredibly common. People that tend to sit and retain their urine and not go to the bathroom when their body tells them they should go. But if you don't take care of your prostate, it's going to take care of you. It's going to screw you up big time. So tell us about Prostate Flow, Hormone Synergy, Men's Max, and Vision Max.
I love thinking about that Men's Max formulation, Dr. Bill, because there's such a demand in the marketplace for people addressing what's commonly referred to as low T. And it's where people say, I guess I need to have more testosterone in my body and so forth. But the irony is most men have plenty of testosterone in their bodies, but they don't have is testosterone that's bioavailable in their bodies. And so Men's Max, using a specific herbal blend that's been studied, has shown that it can increase that free testosterone and make it bioavailable to the tissues again. And boy, do people get to feel the difference on that. That's a really remarkable formulation.
Yeah, it really does make a big difference, doesn't it?
Yeah, and then, as you said, is prostatism a big deal? Well, it is if you have it, that's for sure, because nobody wants to live a life that's so compromised like that. And so, using something like the Prostate Flow formulation to keep things, 1, protected, 2, functioning like they should, it's danger.
It's a very
and
big
a lot
deal.
of the stuff that's on the marketplace just doesn't have the potency or the bioavailability to truly create the impact that it needs.
Exactly.
For people.
Well, one of the things that I want to start is restoring energy. And I have sitting on my desk right now a glass of Sports Energy Lights with a Brain Bag and Calm Mind. I'll tell you, this stuff not only keeps you calm, but keeps you sharp as a tack. Keeps your energy up, stops cramps. Sports Energy Light, one of our new instant sachets. It's so powerful, it has to be in a nitrogen sachet. And you get 30 sticks, 256 grams. It's an amazing price. Tell us about Sports Energy Light, Brain Mag, and Calm Mind. This is my super drink. And, of course, I throw into a D-ribose and ALC 1000 as well. So
love them. And I love these formulations. The Sports Energy Light has just been a very popular formulation, because so many people are already trying to take a sports drink of some sort or an energy drink of some sort. They're certainly taking antioxidants. Why can't you combine all those things into a very powerful formulation that's good for you versus the ones that are laced with, abnormal sugars, chemicals, colorings, bizarre ingredients that you really don't want to consume on a regular basis, or if at all, and change that all around so that you're getting something that's so powerful. So it delivers a very powerful load of electrolytes. Oh, I think we'll maybe catch on that as soon as we get back, but the Sports Energy Light is going to be remarkable.
Yeah, if you take this along, and I like to throw in the our Mega Muscles powder too, and you exercise. I'm doing my exercise lifting. I can see my muscles blowing up, strength increasing, power. Nutrimedical report. By the way, I had an interesting question. I had a 10-year-old boy that's having trouble with bedwetting. That usually means that there's low-grade infection and a neurological lack of maturity of the neural control of the detrusor muscles of the bladder. I usually recommend that they open up a capsule of Allison Med and take in a smoothie or in custard or something like that twice a day. And the reason is I wanted to get enough of it in there. And the key issue is that we want to restore the normal bladder activity, so I recommend the bladder up and Swedish flower pollen to restore normal bladder control activity, and that'll help tremendously. So, Ryan, let's talk more about some of the other amazing nutraceutical solutions we have. And we have everything from cancer to heart disease to traumatic brain problems to Alzheimer's disease. And by the way, I get requests from people about their pets. And I just had a little pet Yorkie that a dear friend of ours had to go to Mexico for because the little one was having seizures. And he's, I guess, 10 years of age. And let's dissect it down. When you have an animal or a person that gets seizures, the first thing you have to think of is that they have either aseptic meningitis or a brain tumor, or they've got some form of bacterial meningitis. The most common thing is infection, actually. And most people don't realize that cancer itself is an infection. It is mycobacteria and fungi and intracellular viruses that turn on and off genes to actually cause it. They're often toxins that open the door for the pathogen to get into the cell and start messing with the genetic switches, which is why if you do a gene switch analysis at labs like in Cambridge, Massachusetts, whether it's an animal or human, and by the way, there are labs now that will test animals for their gene switches and their tumor. When an animal gets older, it's a matter of number one, identifying the gene abnormalities and giving things to protect it or reverse it, like malignant block. To use antipathogenics like our Nutrimedical, Allicin and Silver 100, and things that will help to protect the animal from seizure activity. The most common thing is simply low magnesium, so brain mag. I tell people whether they're getting limbic seizures because they get a mood disorder, or they're having grand mal seizures or petit mal seizures, animal or human, it's basically the same process. We're not significantly different, believe it or not, in our biochemistry from most of our animal pets. We're actually pretty darn similar, aren't we?
Yeah, no, something to keep in mind, and a lot of this stuff has already been, that's where it's developed from, too, is obviously animals. Yeah,
the veterinarians are often 20 to 30 years ahead. In fact, one of the best sources of information on where the direction of medical care should be in terms of pathology and so on is to look at the research in the U.S. Department of Agriculture. They discovered, for example, that turkeys were falling out in the field, the turkey yard, were having selenium deficiency, and the selenium deficiency was resulting in free radical damage, causing aortic rupture and sudden death in turkeys. The same thing as collagen max helps reverse aortic expansion. If somebody calls me and says, or emails and says, I got an aortic aneurysm, doc, how do you stop it from getting bigger? I say, well, first thing is to take collagen max. Boom, they say, I can't believe it. My doctor says my aortic aneurysm hasn't expanded in a year or two. I said, it's because you're following my directions and you're getting the proper ultrasounds done every 6 months. Some of these nutraceuticals people don't realize are so simple, and all of a sudden they say, you mean I'm not going to need a Dacron graft? I said, if you keep your aorta under a certain size and you keep it strengthened, the wall, the elastin and hyaluronic acid and the collagen polymers in the wall of the arteries, you're fine. And then you want to make sure it doesn't calcify, so you take high-dose vitamin K2, minoquinone 7. So we take all these different nutraceuticals and we paint the colors of your future wellness. And in many cases, the more and more I learn how to use these NutriMeds, the field of using drugs is contracting and contracting and contracting. Like if I had my knowledge base right now in 2015, when I went first into practice and purchased the practice of Dr. Kent Remington in 1980, that's 35 years ago, I would have used so few drugs, I would be in front of the College of Physicians and Surgeons of Alberta, Canada, quicker than spit. I'd be a day in practice and say, my God, Deagle, you're making all these people better, but you're not using drugs. We're getting calls from pharmacies and the hospital. You're not using drugs, man. You're a pariah. You got to stop this. You're embarrassing your colleagues. Stop it. That's what they say. People say, no, Deagle, you got to be kidding. I'm not kidding. And the problem is we did know some back then. I knew Stage and Warness and others. And as I started doing research, I realized now after 35 years of doing this, I realized, by and large, much of the medical profession has not advanced. But when they themselves get sick, they call me. They call me from all over the world. Germany, France, Malaysia. Physicians, they're terrified. Like, I do not want to fall in the hands of my colleagues. They'll kill me. I said, you know what? You're right. They will kill you. And they'll poison you first, and they'll look at you like, why don't you take your poison, doctor? It's pretty funny, isn't it?
They don't want to get sick because they're scared of their own system.
They know their own system is lethal. I mean, that's why oncologists won't take chemotherapy if they got pancreatic cancer. 93% by a blind poll. That's because, well, they don't want their patients to know they wouldn't take the treatment.
Heart doctors, if they believe in vitamin E, and they're like, well, I don't really recommend it, but then they'll say, I take it.
or CoQ10.
Or CoQ10.
Fish oils and all kinds of stuff. And the worst bunch are cardiologists, and these guys are like witch doctors, And they're giving things like Pacerone, which is going to kill you, and it's got black box warnings all over the PDR. Or they give HMG-CoA reductase inhibitors, or they give digoxin for somebody with atrial fibrillation that by their own studies will increase cardiac arrest and sudden death by 27 to 70%, depending on which of the studies you look at. It's like, do you understand this is published, doctor, in your own journals? I said, you know what? It's important to read not just the abstract, but the actual article. They don't. Believe it or not. People say, you've got to be kidding, Deagle. I said, no, I'm not, unfortunately. It's worse than you can imagine. Pretty funny, hey? And people say, you're just making this up because you're a radio personality. I said, no, I'm not. I'm a real person that just happens to be doing radio. In other words, I don't need to go and invent material. It's just there. I don't need to have a script writer. I just have to have a good memory. How's that? Pretty crazy, hey? Yeah. Sometimes I have to laugh here because otherwise I said I ran out of crying towels. Hypertension. We use our cardiovasc, but really important people understand. I had this morning a call for this. They wanted to know how to get my, stop heart problems. I said, well, first off, you have to understand what a heart is. Your heart is a primary pump, the secondary pump of your blood vessels. So you need cardiovasc. You need gamma E+. This is really important. You need high-dose magnesium glycinate and magnesium taurate. You need supernox. You need omega supreme or omega supreme krill, too. And if you got an aortic aneurysm, you need to take things to protect your artery wall, ellagic acid, collagen max, and mountain red velvet. Collagen max is the most important. And if you're detoxing your body, you want to take Kilor Max, Xenoestrin Detox, and NutriDefense, and post-radioiodine therapy, mitothyroid, nutriodine, and selenium cruciferate, and Minerals Plus. For your thyroid to work, you need 7 minerals. People don't know that. How many endocrinologists know you need 7 minerals to deiodinate iodine and the 5' enzyme in your glands and your peripheral tissues? Pretty damn close to 0. How's that? We have Tommy, and Tommy asked some very good questions, and hopefully these apply to a lot of other people. Tommy, what are your 2 issues you have? These are regarding 2 individual people. One has tendinitis, the other one has a rest hand tremor. Can you tell us more detail?
Yeah, the first one, I was playing golf with a good friend of mine who's not even 40 years old, and he struck his club in the sand, and he came up with, he had to leave the course and go to the emergency room. They diagnosed him with tendinitis, and I was wondering how to help him with that.
Now, was that lateral epicondyle with the outside of the elbow, or is it tendons elsewhere in the arm?
In the below the wrist and between the wrist and the fingers.
Oh, okay. So he's got an intercarpal tear. It's not really tendinitis. It's what's called an intercarpal fasciitis, and that means he's damaged. He hit it so hard, actually, he caused an intercarpal tear of the intercarpal ligaments. Sometimes most common in golf, by the way, is lateral epicondylitis. It's called cubital tunnel syndrome. And then we have carpal tunnel syndrome in the wrist, which can happen if it's a repetitive motion injury. Real simple. You use tendon mender, 1 capsule twice a day. Sometimes you have to go to 2 for a while, but 1 twice a day. I usually recommend the first week 2 twice a day. Inflamax, INFLAMX, 3 to 5 capsules at least twice a day. Collagen Max, a capsule twice a day. And then topically, you can put curcumin cream on the wrist or on the area of the injury of the tendinitis. It'll help settle it down tremendously because it's transdermal anti-inflammatory. You can add mountain red velvet. You open a capsule under your tongue 3 to 4 times a day. It works much more effectively than just swallow the full capsule, but you can do that too. You can take 1 capsule under the tongue and then swallow 2. And really blast it the first few days to start healing up the tissues. And that will usually do the trick. If you're going to add technology, you can use the Lumen Photon, especially if it's acutely inflamed, setting number 7, and for healing, Nico or setting number 4. and micropulse, and I just jam it up to the top setting and put the little electrodes on it with a 9-volt battery. Micropulse is a very nice little portable device. If you don't treat it this way and you use non-steroidals immediately stop healing collagen. They screw up your ability to create a hydroviscous layer in your joints, and if you've got an intercarpal tear, they prevent you from repairing the collagen ruptures of the microligaments inside your carpus of your wrist. So it's almost certain that the doctors at the emergency room have done the wrong thing, which is give non-steroidals or an injection of steroids in the area, which are both bad for collagen regeneration. And right. you want to turn off the pain and reduce the swelling, so you want to get the wrist elevated above the heart. Ice or gel packs. I like gel packs even better than ice because you can get a gel pack. You can order them even at Amazon and get a gel pack for the wrist and just wear that as much as possible. And the first couple of days after the third day, you're into now going to Nico settings on the Lumen and just jamming the Tendon Mender and Collagen Max. And Ryan, can you add a few things on the tendinitis on those products? Because people don't need to suffer, and they think there's a joint damage to the actual joint surfaces. I would add the joint performance, and of course this responds very nicely, and you're promoting the healing process and terminating the excess swelling of the tenocytes of the intercarpal ligaments, but you're not screwing up collagen synthesis with non-steroidals or steroids. The regular doctors, to be honest with you, do the stupid thing almost always. They'll we're going to give you ibuprofen, and we're going to give you a Celebrex. It's like, yeah, sure, smart move, doc. You're going to screw up their collagen, so eventually, if it's their knee and they're golfing and they walk on an irregular surface, eventually they'll need a knee replacement because you've dried their joint out and you prevented their body from healing, and the calcified fragments of cartilage and menisci and now will turn to calcified razor blades, chopping the joint all to pieces. So, smart move, Doc.
And Dr. Bill, I want to comment on what you're saying there with the NSAIDs and how much damage those do to people. I mean, it is very well known. There's so many warnings on these things, but people treat them as though they're Tic Tacs. It's like no big deal.
Or Tylenol, another thing, substance P blocker. All Tylenol does is take away the pain while you're ripping the joints all to pieces.
Yeah,
Tylenol it also will enter your free entry.
There's these alternatives, like you said, Dr. Bell, like Tendon Mender, there's joint performance, but there's one that is very, very important because some people may not stop taking those because they just don't care until there's a problem. So I would also just be, reminding people that a product like a Gastro Heal would be remarkable for a lot of people that haven't yet gotten to the point of realizing profound negative effects these have, and they think, that's hogwash, and I'll just, I'll take it and try to protect myself. Or make sure you use Gastro Heal with that, because
you're talking about the zinc to increase the collagen production
to protect the gut lining against the damage of those substances.
Yeah, the other thing you do, by the way, the zinc also speeds the collagen and the Power C. Power C, and if you want to increase pro collagen, Her Majesty's Royal Jelly, along with the Power C, is going to tremendously increase the generation of new collagen. So Pro Collagen with Her Royal Majesty's Royal Jelly and the Collagen Max and the Power C Plus, very, very effective. And if you don't want the calcification of the ligaments to occur too, the full vitamin K2 is important. The second question you had, Tommy, was regarding hand tremors. People need to realize that. Tell us about more details about this.
Yeah, I have a good friend who's in her mid-30s who I think is suffering from panic attacks and taking the SSRIs, and she says that she's developed tremors at rest.
Yeah, well, the serotonin reuptake inhibitors do three bad things to you. Number one, if they don't correct the problem, which is the seizure activity in the limbic system, you can also have damage to the subthalamic nuclei and other nuclei that regulate motor activity in the extrapyramidal system, so you can get extrapyramidal twitching, we call tremors, that are rest tremors. Now, if you have an intention tremor that's pill rolling, it's more likely you've actually damaged the secondary motor neuron in the tectum or the roof of the midbrain. That's early Parkinson's. And serotonin reuptake inhibitors, I think, actually accelerate the onset of Parkinson's. So when people take Celexa and these other drugs, they're actually increasing the acceleration of Parkinson's. You have to think of it as a seizure activity of these motor nuclei and of the limbic system that causes panic attacks. So you want to take Calm Mind, 1 to 2 scoops 3 to 4 times a day. You want to take Brain Mag, that actually is protective against oxidative stress. You want to take Cognition Plus, 2 capsules morning and mid-afternoon. Brain Power, 1 capsule at least 3 times a day. And you want to remyelinate those nerve fiber tracts, too, with Omega Supreme Krill, Nutrifos, and Neurogen. Posinol for panic attacks as well, but the most important is the Calm Mind and Brain Mag. And you want to reverse depression. There's often anxiety attacks. You want to start off with BioLVR, which is vitamin activated B6. It's very important for bioconversion. You need the trace minerals, which are in Minerals Plus and Vitamin Mineral Max, to bioconvert the amino acids, neurotransmitters. And I often add NDMEs to increase the nucleoplasm concentration of minerals. And once you get the brain concentration of magnesium high enough and you start to correct the minerals, you take BioLVR. If it doesn't work, you go and bump it up and add Samethyl, a sachet twice a day, superfolate and powermethyl B12, because most of the pathways that bioconvert amino acids to neurotransmitters are what's called pyrrolase and tryptase enzymes that are alcohol dehydrogenase or methylase enzymes, and if you support those metabolically with what I just mentioned, the brain will fix the problem and you don't need these stupid drugs that doctors give. So, and the more that you take these drugs, the more chances you actually have of neurological damage.
Makes sense. I appreciate it. Thanks. I have one last question. I woke up with a head cold a couple of days ago. It's the first cold I've had in 3 years, and now I've got pink eye. So
the most likely thing is you got a sinus infection. And what I would do there is get the vertical nasal spray of Silver 100, take an Allison Med, take this nasal 100 spray, 2 to 3 sprays every hour or two. Take an Allison Med 3 times a day. Nutriodine, I would get a Shiny Pulse Elite to irrigate your sinuses. Because the most likely thing is you don't have a head cold, you have a sinus infection. And it's tracking through the little puncta to the ethmoidal sinus right by your eye, so your eye's inflamed now. And if you're trying to treat the eye, use the Silver 100 drops in the eye. But the most important thing is to get the Allison Med in there and, knock out the infection. In that, but also get a Sinus Pulse Elite and irrigate your sinuses. Glorious time to be free. I don't even need to ask the question, are you having fun yet? I had another interesting thing. I have a lady who was trying to maintain good, healthy milk production after having a baby. And, of course, I tell people the first thing you want to do is get those immunoglobulin levels up, so it's NutriImmune. Probably within a couple of months, we'll actually have our capsulated form of our new 26 immunoglobulins and transfer factors, but our NutriImmune is excellent. It's colostrum. Then, of course, Vitamin Mineral Max to support normal baby's milk production. Neurogen. DHA will actually increase the myelination of the baby's brain. And Nutrifos for solid organ regeneration and healing and growth. Life support, general detox, and Omega Supreme for fatty acids. That gives you kind of a basic protocol. I recommend that if you're trying to restore your bones, because you're going to dump a lot of calcium out to the baby, you want to take Bone Generator, Micelle D3, Myco D2, and full vitamin K2. Especially K2, it's very important for babies because they're growing so fast. By the way, K2 helps the body as the baby's growing, doing a lot of apoptosis. People say, what do you mean? They're killing cells and getting rid of them because the body's growing so quickly, it's restructuring and remodeling everything. And the fastest period of apoptosis in a person is when they're fetus or when they're a baby, believe it or not. People would think it's when you're really old, all your cells are dying. No. Your fastest period of time when cells are dying is when you're a fetus and when you're an infant, because you're actually purposely forcing cells into apoptosis to rebuild the body. Interesting, isn't it?
Yeah.
It's the opposite of what people think, which is why the current approaches to anti-aging are all backwards. I use the term they're bass-ackwards. How's that? If you understand the little twist of words. Post-radioiodine hypothyroidism. People say, well, doesn't the radiation destroy my thyroid gland? You can't get all of it. It's not possible. Same with subtotal thyroidectomy. You only get between 40 and 60% of the gland if you do surgery, even if you're a top surgeon. You can't possibly get rid of all of it. If you try to get rid of all of the thyroid, you'd bleed to death. Because there's so many blood vessels there at the base of the gland. It's so vascular. So Mitothyroid, 2 capsules twice a day, and Minerals Plus and Nutrimedical are Tesla-activated monotopic iodine, and we'll often add selenium cruciferate. But mitothyroid, what's in it? Why is it so important? Because a vast part of our population are hypometabolic because they're pre-diabetic and have high insulin, or they're hypothyroid, they have antithyroid antibodies, thyroglobulin and antimicrosomal. Hypothyroidism, especially with syndrome X or metabolic syndrome, is incredibly common. I mean, Dr. Broda Barnes proves that basically anybody with heart disease is hypometabolic, and their hypometabolism of their mitochondria is what causes plaque, hypertension, and vascular diseases, all a hypometabolic state.
Yeah, this is such a massive issue for our population. I know it's spreading around the world, but getting the thyroid function properly, and so you end up with an abundant amount of people having to use, thyroid hormone and so forth. And the question is, can these people be, can they, normalize their function before they get stuck into those kind of systems? And mitothyroid provides a really cool option for people to support the thyroid itself. And then what's so nice about it is it's not just the thyroid formula. It does support, to a lesser extent, but the hypothalamus and the adrenal, as well as the thyroid. And the purpose behind that is to keep them in balance, because they will all work together with one another in conjunction to help the body to be regulated in the right way. And so for people with thyroid issues, they know they get stubborn weight loss, they get, dry skin, hairs falling out, they get all kinds of crazy problems, and so many things are linked to, well, your thyroid's just not working right. Well, just taking a little bit more hormone may not make it work right either, but making sure that you're supporting the body with nutrients that may be deficient could be a really big breakthrough for a lot of people that haven't been down that road.
Yeah, and a lot of people are not really aware that their health providers basically are completely ignorant of the biochemistry, and I'm going to explain the areas in which, to me, if medical school or chiropractic school, whatever, would be years longer than it currently is, or naturopathic school. They would learn intermediate metabolism, they'd learn toxicology, they'd learn infectious disease, they'd learn plasma physics of biological systems, they'd learn nonlinear diagnostics, and then have a smattering of understanding of all the other specialties so we could all work together as a orchestra, whether you're a chiropractor or a surgeon or a primary doctor or a nurse practitioner or whatever. And I also would like to see what I call lateral training, where people could start out as a massage therapist, and if they take the right proper training, they can actually, 10 or 15 years' time, they could be a neurosurgeon. To me, you don't have to go linear, like I went to this school, got my PhD, went on to this medical school. I think that people need to also maintain their levels of knowledge to prove that they're still competent in a particular area, but they should have nothing to do with government, state or federal. Government should keep their paws off health care, including insurance. Basically, you should just prove you have insurance because you're a citizen, and it's nobody's business. You shouldn't have to buy insurance. If you got health care, the doctor's paid an hourly wage based on your years' experience and training. And if you want to give tips, that's totally up to you. To me, the healthcare system is ridiculous. My fix would be considerably cheaper. Doctors would be happier. People would be happier. They get good response. And they would nobody would be playing prima donna games. They would actually have to prove evidence that what they're doing is actually beneficial to the patients, rather than surgeons cutting because they get paid more by cutting, or doctors admitting more when really there's no need for admission. A lot of time people can be taken care of patients. And of course, diagnostics are not being done correctly, so real disease states aren't picked up early enough. Ryan, one of the other things I'd like to talk about is some of the other nutraceuticals that are particularly important. Anti-Age Max. This not only slows down the aging process, but it also stops cholesterol from being oxidized. That's one of my favorites that we haven't talked about for a while. Allergon and Allerblock for stopping allergies. Our gentleman earlier was mentioning he had bad sinus problems. A lot of times there's infection, but there's also allergies. So Allergon, which is a DAO and diamine oxidase, removes histamine and toxic allergic reactions. And Allerblock is the antihistamine, natural antihistamine. It's not going to sedate them and do weird things like give them amnesia, like some of the antihistamines. Some of my other favorites, too, are things like Biotin Plus, that works along with diabetoline for diabetes. And Carbo Block and lactose blocker. Carbo Block, I'm telling people, if you're trying to lose weight or get your muscle mass up and lower blood insulin, you got to take Carbo Block and lactose blocker, because milk sugar is everywhere. And milk sugar is going to blow your insulin through the ceiling and also cause gut dysbiosis if you don't get rid of it. In fact, excess lactose in a baby can give, life-threatening diarrhea, which is why you can't give, regular cow's milk too early to a baby, because of the high concentration of milk lactose and allergens present in the milk. So it's something, and we have the only neutral pH lactase enzyme available. So any comments you want to make with any of those?
Well, yeah, the DAO, and that was the Allergon, is just amazing, because you're talking about fundamentally going after histamine in a different way. It's an enzyme just like you would think about an enzyme to help you break down proteins or fats or sugars. But in this case, it's one that our body produces to help us regulate histamine that we might be exposed to from foods, or that might be triggered based on our exposure to things in our environment. And by regulating that histamine, you change kind of the systemic pool, which then can change so many of the different challenges. And it's such a neat thing to see people that have had weird, kind of, if you will, the yellow canaries, they're the ones that are the first reactors in the coal mine, right, to something that's poisonous. But to a lot of people, those same substances don't seem to bother them. Well, this is a formulation that can be a life changer for a lot of individuals that can't explain, nor could their doctor explain, why they are so reactionary to so many different things. And that's been a huge game changer for a lot of challenged people. And I know people that are listening to this show are just like that caller earlier. They're the ones that are reaching out saying, I'm at my wit's end, there's weird things happening, and I need to get some different answers. And that's the good news. There's a lot of different options out there to take into account and to start to utilize.
And if people don't get better right away, they need to kind of clarify it. For example, I had a call this morning to consult a lady that had spider nevi, and she didn't have yet varicose veins. I said, well, she only took 3 bottles of the vein away. I said, well, you need additionally. It's going to take longer than that to get rid of them. Now, if you have varicose veins, those need to have, and I like the laser surgery better than even the surgical intervention. I think surgery is pretty traumatic. The spider nevi will take 6 months to 2 years to go away, but they will go away. But I recommend you take, in addition to that, things to heal the blood vessel walls, such as ellagic acid, omega supreme krill, Nutrifos and Neurogen. These are all going to heal the blood vessel wall and omega supreme. So it's important to do it long enough and to take enough things with it to actually get reversal. Some are going to require surgery. You're going to stop forming new varicose veins once you take the vein away. But the old ones, you're going to need to have surgery done. Usually laser is the best. But no new ones, and the spider nevi will go away in 6 months to 2 years if you continue.